My first meeting with Sinatra was very memorable. So this is going back to maybe 12, 13 years. I was doing my A4M membership, American Academy of Anti-Aging Medicine. So we had an afternoon of cardiology with Dr. Sinatra. So it was great. We had like 3 or 4 hours with him. So I kept on asking questions, and I kept on raising my hand because I knew the answers. So finally, after about 45 minutes, he says, may I ask you what your specialty is? So I'd say cardiology. So everybody laughed because it probably was the only cardiologist in the room other than he and him. So I want to see you afterwards. So we met afterwards and ended up participating in an infomercial that we did here in Los Angeles, where I met his wife Jan. And then he got me interested in earthing, which is another great topic of his. I was extremely interested in it. And we did a study together on the effects of blood pressure. So he was a wonderful teacher. And I'm most proud and honored that he wrote the foreword to my book that's coming out after the Labor Day. So it's precious to me that he wrote that foreword and did an excellent job. And so I'm indebted to Dr. Sinatra because I was always a thinker outside the box, but I finally found someone in my field who was successful in what he did. So I didn't have to feel alone anymore. So I owe a lot of gratitude and I honor him tremendously. I'm glad to be here tonight.
Thank you, Howard. Johnny?
Gee, I don't even know where to start. I owe so much to Steve, and he was such a gracious, kind, generous, spirited human being that infused every interaction you had with him, and in no particular order. He and I both stumbled on that Lean diet heart study that you mentioned completely independently, and had the same kind of epiphany. That data does not support what we've been told. And we both started wondering about it. And we had so many other things we found in common. We both did postdoctoral work in psychology. I have a master's in psychology. He was trained as a bioenergetic psychologist. And I think it really informed the way we looked at disease in general. We devoted, in the revised version of The Great Cholesterol Myth, we spent 1/3 of the book not talking about diet, exercise, supplements, or anything. We talked about heart math. We talked about community. We talked about relationships. We talked about sex life. We talked about the gut. All of these things, about walking in ecotherapy, walking in the greenery and getting sunshine, and how all of these things had powerful, powerful effects on our physiology, on our hormones, on our immune system, on all of these things. And he realized that so profoundly. I mean, when no one was talking about mind and body. And also when you were listing his books, one that you didn't mention was so influential, not just for me, and so prescient. It was Heart Disease for Women. He was one of the first people to shout out, the emperor has no clothes, when it comes to all the studies that have been done on heart disease that used only male patients. He was one of the first, even pre-woke, to say, heart disease presents differently in women. It's different symptoms, it's different, they're different creatures, they respond differently to pain. You got to look at this as a whole other thing. And people, now they talk about that, but they forget that was Steve, like, I don't know how many years ago he wrote that book, Drew. It must have been 15 years ago. So he was on to a lot of this stuff very, very early on. I had some writing successes before I met Steve. I had a bunch of books, the food book and stuff. But if he hadn't agreed to write that book with me, and I'll tell you exactly, if you're interested, I had a book deal with Harper that because I wrote the 150 healthiest foods on earth, and they wanted a whole bunch of sequels to that because it was a hit. So like, with Die Hard, you want Die Hard 5, Die Hard 6. So we had 150. Well, that's what they do. So we had the 150 best ways to promote your energy and the 150 best ways to live longer. And they came to me with this idea. They said, we think the next great book will be, how about the 150 best foods to lower your cholesterol? And I said, that's a wonderful idea, but it's certainly not for me. And they said, why? And I said, because I think that's the wrong target for heart disease. And I think we're just moving in the wrong direction. What are you talking about? So it led to a discussion. And I presented my case. I sent them, studies and they said they were afraid to publish a book that questioned the cholesterol hypothesis. And finally, after much debate, and I was very persistent, and I sent all the studies, they said, look, we can't publish this by some cockamamie nutritionist who's, on the left wing of things anyway. He said, we will publish this if you can find an MD to co-author it. But it can't be just an MD. It's got to be a cardiologist. It can't be just a cardiologist. It has to be a world-renowned cardiologist. You got one who will endorse this? We'll do it. I call up Steve. I said, Steve, you want to write a book that'll blow the lid off the whole cholesterol thing? He says, I'm in. And that's how that book got done. And it wouldn't have gotten done if he hadn't signed on as a co-author.
What a great story.
I love that.
Drew?
Gosh, I'm like Johnny here. I don't even know where to begin with the story, but I think seeing my father evolve from a conventional cardiologist into the man that he was, 2 months ago, was such a beautiful journey to see him move along with. I mean, this guy had like a health food store that he opened, and I think it was like 1987. I mean, I was 7 years old then. And I remember all the food on the shelf. He had this thing called like something like the Roger Buffalo cookie, which was just like the first power bar ever out there. Like, maybe Power Bar was there at that point, but there was no other bars in the market. Right?
Tiger milk bars. They had
Yeah,
milk
exactly.
bars.
So he was just a pioneer in the thinking ahead, right? It's like, people need food on the go. Let's develop this bar that people are going to quickly eat. I mean, look at the bar market today. It's massive.
Right.
So he was always a thinker. He was always ahead of his time. And it was such a beauty watching him evolve and develop supplements that I started taking when I was a young teenager. And, my friends made fun of me because I took all these vitamins and such, but I'm so grateful that he got on that path, because then it really put me on the path of becoming a naturopathic doctor. And short story here with the cholesterol is I think I went to the Manchester Memorial Hospital, which you mentioned, Ben, where he was chief of cardiology. He gave a talk on statins. And it was just the coldest energy in the room. All the fluorescent lights were kind of like flickering. And I looked out in the audience, and all the doctors just were unhappy. They just weren't happy. And they were very angry that he was presenting another side of cholesterol, which was, hey, be a little cautious in your prescribing. You don't want to just give this stuff out like candy, like we've been doing for the last decade. So I saw that, and I really looked up to how much courage he had to stand up to these doctors and say, hey, we're basing this on a theory right now. This is only a theory, and we should take it as that. Let's have more evidence come in before we just willy-nilly put everyone on a statin. And the doctors were mad. They were furious. They said, how can you do this? This is against standard of care. And the thing about my dad is he didn't get angry. My dad never got angry, right? He kind of just said, okay, and he'd walk away, and I could tell that he would think to himself, well, when these guys are ready, maybe they'll join on and look into the theory of heart disease in terms of cholesterol. So I could go on, but I just had to share that story about the cholesterol in Manchester Memorial Hospital.
That's great. And it's interesting. You guys both brought up the idea of questioning conventional thinking. And in the news, just in the last day or two, is this revelation that the landmark study that showed that the cause of Alzheimer's is a buildup of amyloid plaque. It turns out that, according to this analysis, that study was falsified. And it's a huge shock to the whole medical establishment, the research, and very, very interesting, that they've been developing drugs for Alzheimer's based on this concept. And of course, the drugs don't do very much. And that's why we had this big controversy last year over that amyloidobab, or I'm sure I didn't pronounce it properly, but this new drug was the first new drug for Alzheimer's. That
terrible
was
drug.
Exactly. 30% of the patients get inflammation, swelling in their brain, and nobody gets better. They just get worse at a slower rate. But anyway, it's all based on this concept of what the cause of Alzheimer's is. And now that whole concept is now in question. So there's a perfect example of wanting to question orthodoxy.
Can I
Yeah, of course. Go ahead, John.
Tie something in with Steve's message and with what you just brought up. And I think it's so important. He would kill me if I didn't make sure that we all knew this. Because you had mentioned earlier that one of our theses was that what really causes heart disease is inflammation and oxidation. But Alzheimer's, as you guys know, and maybe some of the people in the audience do, Alzheimer's is now being referred to as type 3 diabetes.
Right.
The reason for that is that we have a epidemic of a metabolic condition which underlies not just diabetes and prediabetes and hypertension and obesity and heart disease, but also Alzheimer's. And it is the same metabolic condition, and it is called insulin resistance. And it also coincidentally underlies the three major comorbidities for COVID, as well as the ones I mentioned: lung disease, heart, kidney disease, and liver disease. So we have this insulin resistance, this epidemic. When Steve and I redid The Great Cholesterol Myth, when we went back and did the revised edition and looked even more deeply into the research that had been done since 1970, we found that insulin resistance predicts heart disease better than any other metric except possibly lung capacity and volume. It is a fantastic predictor for every chronic disease that we care about. And it's been my passion and my message, not especially since Steve died, but really since the book came out, to get that message across to people that insulin resistance is where the action is. That's what we should be looking at. And insulin resistance can be turned around, it can be prevented, it can be reversed by diet, fasting, and lifestyle. And that was the message of our book. And Steve believed that. And since you brought up Alzheimer's, I think it's only appropriate to bring that up because that's central to all of those.
The problem is not gone by any stretch. In fact, a recent study came out. I knew from a study about 2.5 years ago that only 12% of the adult American population is metabolically healthy.
That's what I'm, and what does that mean? What does that mean?
3% of the adult American population is metabolically healthy. More women than men. And this just came out about a week and a half ago.
Yeah, and that study, the one you were talking about, which came from the NHS data,
Correct.
that says only 12% of metabolically healthy, they are talking about insulin resistance. 88% of us have some degree of this insulin resistance. And guys, if you don't know what that is, it is the inability of the body to manage the carbohydrate load that you're giving it. And that leads to inflammation, oxidation, and slowly but surely heart disease, Alzheimer's, prediabetes, and the whole gamut of metabolic diseases. And Steve knew that.
Right. So what else should we say about the role of cholesterol in heart disease, and what other things did Dr. Sinatra revolutionize in terms of the way we think about LDL? And
I think that he was as passionate as I about saying that we are measuring cholesterol incorrectly. That we are still talking cholesterol. Can I just 2 seconds of background for those who don't know?
absolutely.
Cholesterol is carried in a container, and the reason for that is the molecule itself is hydrophobic. It can't live in water. It's like it's oil and water. It doesn't mix. So it has to go in the bloodstream in a container. The container is the lipoprotein, the L in LDL.
Right.
Some lipoproteins are low density, which means that they float, and some are high density, which means that they're heavy and they sink. But these lipoproteins are the boat, the cholesterol is the cargo. Somewhere in 1963 or so, when they figured out the cholesterol travels in kind of two basic kind of containers, and they gave them the idiotic names of good and bad, we got into this notion that there's a different kind of cholesterol that travels. It's all the same cholesterol, travels in two containers. And what we have realized in the last 20 years that the mainstream profession does not get is that the containers are what the problem is. It's the containers, the LDLs, that get caught in the endothelial wall and cause a plaque and heart disease and all the rest of the stuff. So the new tests for cholesterol look at the number of boats in the water.
The LDL particle number.
Yes. And that is the test that we should be using. And any prescription that's given based on the old test is about as valid as a prescription given on the cosmopolitan horoscope of the day. It's completely magical thinking. We need to know how many boats are in the water. And that's the message of the book. And it was Steve's message. When people tell us, my cholesterol is high, the first thing we always ask is, by what test? And if they say, well, the LDL and HDL, we stop talking. Go back and get the real test. That's a fake test.
Right, because that LDL number is estimated.
Happening in the real world right now. You're absolutely. I've been doing specialized lipid testing for 20 years, and if you're dealing with Medicare, Blue Cross, Blue Shield,
forget
let me
it.
tell you, they do not like me. They do not like doctor that order specialized lipid testing.
I'm with you. I understand.
It is unbelievable what my staff has to go through just for the labs to get paid, because we have to send records, why I ordered it. I mean, it's crazy. So there's so much work that needs to be done.
So much work.
The doctors ordering the right test. It's like getting these things to be paid, because they just want us to do a simple lipid panel. That's all they care about.
I know.
And that's
Yeah, for my take, you're never going to get anywhere with insurance companies. The key is maybe some point in time we'll stop insurance companies from running the healthcare system.
Well, that would be very nice, wouldn't it?
Yeah.
it's expensive testing you're talking about. It ain't cheap.
Yeah.
Well, Johnny, correct me if I'm wrong here, but I know my dad was really big on Lp(a), lipoprotein A, and making sure that that was added on to any sort of lipid panel.
Yeah.
As that can be a more atherogenic lipid
The
particle.
nastiest of the LDL particles. The thing about Lp(a) is that there's really no way to change it. And that's kind of the dirty secret. I think Steve had a couple of supplements he thought might make a difference with that, like nattokinase and stuff, but it's a really hard number to change. So sort of once you know your number, I don't get it tested every year. And I think that might be why it doesn't get as much attention. There's no drug that can bring it down. I mean,
that's exactly why. Yeah. Yeah. And by the way, there will be a drug in a couple of years, and then everybody will be testing it.
Right. Exactly. Then they'll tell you how important it is.
But
right now, it's not important.
Niacin can move the number some. L-carnitine can move the number some. There are some things that can move the needle.
Oh, good to know. Okay.
Yeah, you can get about a 30% reduction with niacin.
Yeah, that's the biggest mover. But I mean, nattokinase, Baluchi, all those, I haven't had great success with those.
Neither have I.
It's like raising HDL. I mean, they tell you exercise. No, it doesn't. Come on. Nothing gets HDL higher, in my experience. And I'm not even sure it matters that much.
Right. And then we not only had the LDL particle number, but the particle size, the fact that the small, dense LDL is much more atherogenic than just the amount of LDL.
And the size is also a very good stand-in for insulin resistance. If you've got a small particle size and you got a high triglyceride to HDL ratio, you almost don't even need to be tested for insulin resistance, because that's a great surrogate right there.
And by the way, that's one of the unfortunate problems with statins is they don't do anything to improve LDL particle size.
Nothing.
But they have an anti-inflammatory effect, which we're not aware of when they came out in the 80s when I was a fellow. We just thought, it lowers LDL cholesterol, it does it quite nicely. But we later learned, years later, 15, 20 years later, that it actually does have an anti-inflammatory effect.
It has, and it also, as Steve used to point out all the time, it tends to thin the blood slightly. So it kind of turns what he called, ketchup into red wine. And those are important values of statins. As Upi argues, statins would probably be better medicines if they didn't lower cholesterol and they just did that. But I would argue that though they may have a slight benefit as being anti-inflammatory and slightly thinning the blood, you can do both of those things with zero side effects with ginkgo, vitamin E, or fish oil.
Mm-hmm. Well said.
Okay, so next topic is Dr. Sinatra's contribution to the importance of a healthy diet for preventing and reversing cardiovascular disease. Howard, you want to maybe start us off?
Yeah, the whole thing with already been mentioned is the Mediterranean diet, and it started with the Lyon Heart study in the 90s, and then the Predimed study came out in 2013, which was actually primary prevention. The Lyon Heart study was really based on secondary prevention, and so it showed whether you combine olive oil, nuts, whatever, that Mediterranean diet actually was, and it's no other diet has been shown thus far to be as effective in decreasing heart disease. So it kind of put that on the map. So that's my take. And I know that Sinatra and I have had many talks about the Mediterranean diet. There are lots of different aspects to it. Some people think it's too much carbs, too many, I don't imbibe on cereals. I don't think there's a healthy cereal out there, but I think the basic premise behind the Mediterranean diet is quite good. And we have research behind it.
And
yeah,
I don't think Steve and I 100% agreed on the Mediterranean diet thing. I was always trying to get him to eat a higher fat version of it with less grains. The thing is, he came from that world where the Mediterranean diet was the dietary answer. And epidemiologically, there's great evidence that it's associated with all kinds of great things. I've always been much more of a skeptic. There are 22 countries in the Mediterranean. They don't all eat the same diet. There's Turkey, there's a North African country. They don't. When I was writing Living Low Carb and looking into the Mediterranean diet as a thing, I looked at menus that are currently available at all of those countries in the best restaurants, and every one of them has meat on it. So I think that there's a variety of ways to eat Mediterranean style. I think, and Steve and I agreed on this, it's not just the diet, it's the lifestyle. They spend time in the sun, they take naps, they talk to each other, the men express their feelings. There's a lot of differences between the way they live in the Mediterranean and the way we live here. So it's not really just this one thing. But definitely that style of eating, if you will, or the things it has in common, the higher amounts of nuts and the good fats and all of that stuff is a very good place to start. I would tweak it a little with less grains and a little more fat, but that still that doesn't make it any less Mediterranean.
Right.
Well, let me lead into this with a story, in that my dad was paranoid about saturated fat in the 80s. And so guess what we did for 10 years? We had no meat. Okay, he just didn't buy meat, and instead we had swordfish steaks on the grill all the time. And, and I mean, I can't even tell you how mercury toxic my whole family probably is. But that's how, at the time he was thinking to himself, hey, I'm giving my family fish. There's some omega-3s in there. It's got to be good for you. And then all of a sudden we learn about tuna and swordfish and all the other different larger fish in the sea that are mercury toxic. And so I thought that was kind of funny, because I can still taste, what swordfish is like.
Wow.
So yeah, he loved Mediterranean diet. And I think for him, being Italian, it was probably hard to get off the pasta, right? That's sort of like a staple of the Italian diet, or at least we think it is. And so my father always, he did believe that olive oil was really like the secret sauce. And I do think that he was onto something with the olive oil. So I do believe that olive oil can help drive a lot of these positive things that we see with Mediterranean diet, and agree with Johnny and all you about in terms of reducing carbohydrates and that sort of thing.
Let me tell you a story about the olive oil.
Mm-hmm.
So the particle test, this whole thing we've been talking about with the particle test, I have a personal story about that, because my LDL, HDL numbers were perfect for like decades. And then, and any doctor, would look at it and go, oh, it's ridiculous, boy, you're just in fine. And then when I became a functional nutritionist and learned about this and saw that that was a bogus test and got the real test, I find that I'm in the high risk zone for particles, and I've got the worst kind of size. I've got the pattern B, which is, as somebody mentioned earlier, the little
Small, dense,
small dense ones. I've got this. I'm an example of how the test of being undertreated. In other words, I was a false negative. They said, oh, he has no problem whatsoever. And in fact, when you looked under the hood with the right test, I had very high particles. So I have all these wonderful, amazing functional cardiologists in my network, starting with Steve. And I asked their opinions. Guys, what do you think? I mean, I got a serious particle problem. What should I do? And I'll be honest, one of them said, I know you're not crazy about the statins. I think we should try maybe 5 milligrams of Crestor. Others said, at your age, it's absolutely not necessary to do. I went to a cardiologist at Scripps who gave me certain supplements. I got a little stricter on my diet. And here's what Steve's advice was. Steve said, before you go on the statin, I want you to take a 1/4 cup of olive oil every day for 3 months, and then let's remeasure. So I did. He literally prescribed olive oil, and I do to this day. If I had the proper, I chose. I literally swig it from the bottle, and as a medicine every day. It's one of my supplements, and I did that. I can't say it was just that, but the supplements that Dr. Triffin at Scripps Institute recommended, the stricter adherence to the higher fat, lower carb diet. But my particles went from 2,200 to 1,600, and my particle size went from B to A. So, you know, I think the olive oil had a lot to do with it. It may not have been the whole story, but that's the way Steve was. He's hold the medicine, try the olive oil. Let's see what that does.
That's great.
Yeah, and I know Dr. Houston's very big on olive oil too.
It's great food. It's a medicinal food. There's no doubt.
Yeah, you got to get the right olive oil.
Yes.
Yeah. It's got to be extra virgin, organic. It should all come from one country. You should name the specific type of olive that's there. And if it has kind of a bitter taste, that means it's going to be higher in the polyphenols.
There you go.
Yeah. And by the way, I don't know if anybody knows this, a little trivia. There's a book written not too long ago about a food writer and expert, and he said the 4 most faked foods in the world: Kobe beef, Parmesan cheese. I forgot the third, and the fourth was extra virgin olive oil. It is so they lie about that on the label consistently. So you got to be really, really careful. Steve had his own olive oil company.
Yeah, to be honest with you, most olive oils don't even say on the label what type of olive, where they're from.
And they're mixed, a lot of them are mixed and compounded with other oils. And
right.
They're tainted. They're tainted.
Yeah. Yeah, I had an olive oil expert on the podcast, and one of the things he emphasized is it should say what country, and it should name the specific type of olive, like Korniki olives from Greece.
Yep.
And so next topic, let's talk about the importance of some of these nutraceuticals that Dr. Sinatra pioneered, like coenzyme Q10, L-carnitine, magnesium, D-ribose.
He called them the Awesome Foursome. Drew could probably talk about it just as eloquently. I mean,
No, you go ahead first, Johnny. Go ahead.
Yep.
Well, these were the 4 nutrients that he felt were really powerful for heart disease, and carnitine, because it is it transports fat into the mitochondria so it can be burned for energy. Magnesium, because it's just needed for 300 different biochemical operations, and it lowers blood sugar and it lowers blood pressure. Coenzyme Q10, he was one of the biggest proponents of coenzyme Q10, which basically is a nutrient that helps your heart make more ATP. It helps everything make more ATP, but the heart never takes a vacation. So it was very, very heart healthy nutrient. And D-ribose is something we're using to this day. And it's so funny because he was prescient about that one as well. D-ribose is a naturally occurring sugar, which has a number of incredible properties that he realized way before the rest of us did. Number one, it helps the cells to make ATP, and it does this by turbocharging an enzyme called AMPK, which is kind of a master metabolic controller. It's like the air traffic controller of the cell, and it is responsible for making the cellular Bitcoin, which is ATP. That's the stuff you need to do absolutely everything, from talking to waving your hands to dancing the mambo to blinking your eyes. You need ATP, and coenzyme Q10 helps you make that. And and D-ribose helps you make that. And what we have found recently about D-ribose, I use it in my coffee because it's just such a great way to help, at the cellular level, to help make energy. And I wondered myself, I thought, this is awfully sweet tasting. It's really fantastic. If you like, stevia or monk fruit, any of that stuff in your coffee, this is just as good, but it's got to raise your blood sugar, right? No, it's the miraculous thing about this naturally occurring sugar that's good for energy is it actually has been used in diabetes treatment, and it actually helps lower.
It's a 5-carbon sugar versus a 6-carbon sugar like glucose and sucrose.
Exactly.
That's the difference.
Exactly. So that was one of his awesome foursome. And to this day, I use, I would never be without magnesium. It's one of my 3 basic supplements for everybody. And D-ribose is right on my counter right now to this day. And coenzymes is my vitamins.
Yeah, I'll add to this that I think my dad pioneered it with cardiovascular disease and supporting heart, circulatory system, and all that. He wrote his book, Metabolic Cardiology, which was all about using, these supplements and, talk about heart failure, helping with hypertension. But I believe now that just with things we're going, like we've learned that, hey, you could use this protocol on someone with migraines. You could use this protocol on someone with chronic fatigue or fibromyalgia, or someone that suffered with a long chronic illness like Lyme disease, for example. So it's multifactorial in what we can use it for, which is beautiful because it's not just for the heart, but it's for the whole body, charging up every cell, like you were saying, Johnny.
Yes.
And I just feel like my dad really, especially CoQ10, I really feel like CoQ10 was like his baby. and he really nourished that baby and brought it to life. And I believe it was 1986 that he had that on formulary at Manchester Memorial Hospital. Think about it, 1986. Like, I mean, I don't even know. I think I was around 6 years old when that happened. And that just blows me away that he was just so advanced in his thinking back then of CoQ10. And then all these others were brought on board. It was sort of, CoQ10 was really the beginning. And then I think it was magnesium next, and then it was L-carnitine. And the last one was really the addition of D-ribose. So it was really just so beautiful to see the evolution of the Awesome Foursome over time and how it can not only support the heart, but the rest of the body as well.
Getting CoQ10 into the formulary, I can't emphasize how important that is. My mother died of congestive heart failure in the late 1900s. I went there and I said, can we put her on, a couple 100 milligrams of coenzyme Q10? And they said, what is that? And I said, it is a enzyme that is used to make energy for the heart. It's used in Japan as a prescription medicine for congestive heart failure. There's major research on it. We didn't have the internet then. I printed out pages and pages of stuff. I brought it to them. Didn't matter. It wasn't in the hospital formulary. They never heard of it. Do you realize?
And it's still not in the formulary. It's still not in the formulary.
Huh?
It's still not in the formulary.
So getting it in the formulary in Manchester General was people. I mean, hats off, man. That's just incredible.
Well, one of the things that not everybody may realize is that the heart, unlike all the other organs, is the most dense with mitochondria, which is what produces the energy. And coenzyme Q10 is so crucial for mitochondrial function. So it makes a huge amount of sense. And I know, Dr. Elkin, you use those nutrients in your practice as well.
I have a very active practice, and a lot of patients with cardiomyopathies. Everyone with cardiomyopathy gets all four of those. And I do CoQ10 levels. People that have cardiomyopathies and congestive heart failure really should have levels of 4 or 5. And so I go by levels. Usually people are at least 400 milligrams a day. It's also been used for in Parkinson's patients. I've added to Parkinson's as well. And L-carnitine and the D-ribose. I've used it in chronic fatigue. I've used it in other, states like that. And it's funny. Now, I do have patients on statins because I have a lot of patients with confirmed coronary disease that have had stents and bypasses. So I don't just have preventative. I mean, I have primary prevention and I have secondary prevention. People need to know that in secondary prevention, it hasn't really changed. The standards are pretty strict, because patients on statins generally do better. But anyway, anyone that goes into statin in my practice automatically goes on CoQ10. I mean, it's a must. I tell them right then and there.
Where do you stand, just as a side bet, on the ubiquinol versus the standard
Ubiquinone? Yeah,
ubiquinol.
That's funny, because I asked that question more than once to Steve, and he didn't think it made a difference. I specifically said that patients are saying ubiquinol because they see it in the Life Extension Foundation, right? And said, I asked Steve about it. Do you know anything, Drew, about that?
No, same thing. I kept asking him over and again, and he basically would say that they're equal, and that there was a big marketing push out there to get ubiquinol a better product, but it really was the same.
Yeah. Right. He told me that there may be cases in which, for some reason, the person doesn't absorb the standard one as well, and there may be an advantage in those cases, but he was very squishy on it. He thought basically that, as he pointed out once, there's like 18,000 studies using ubiquinone before ubiquinol even came out, and we had pretty good results. So there was. And
checking levels do help. Cleveland does it, LabCorp does it, Boston Heart does it. So they will do CoQ10 levels.
Well, Howard, thanks for doing that, because I know my dad measured levels way back in the day, and thank goodness you're carrying the torch there and continuing with that, because I just a reminder, I don't do that with my patients, and I probably should.
Thanks.
Yeah.
I've never had my levels measured. I may come to you and get them measured. That's be an interesting metric to know about.
Yeah. Yeah, it's also included in the micronutrient test from Vibrant.
Good.
Which is,
okay.
Yeah, they've kind of done the old SpectraCell micronutrient test quite a bit better. So let's talk about the role of emotions in heart health, which is something that Dr. Sinatra was probably one of the few cardiologists ever to talk about.
You know, Stephen gave me this book,
Mm.
Heartbreak. I'm so glad you brought that.
and so I started reading it. I said, Steve, this is like amazing. He said, Howard, that book was written 20 years ago. I
Yeah.
didn't thought it was. I said, are you kidding me? Because I related to so much, you know, 'cause I'm a body mind kind of doctor, and I believe whether it's cancer or heart disease, they're correlates.
Yeah.
Yeah. So I totally support his work in this. This book was, you know, changing.
But are there certain insights you got from Dr. Sinatra's thinking about this that have helped you with some of your patients?
Yeah, specifically, it's interesting. Like cancer patients are a little different than heart patients. Because heart patients, they say it's type A personality, which has been changed over the years. You know, competitive and blah blah blah. And I'm kind of type A, but I'm not cynical and I'm not angry. Those are the two other, they're the bad characteristics. But cancer patients, a little different, they tend to repress a lot of their feelings. And he talks about that in this book. And I see that a lot. I do talk about, I mean, in my practice, I teach patients how to breathe. Meditation is an important part of what I do. I mean, I teach it and about getting emotions out, you know, I talk about it in my book, and I practice it every day with my patients. They have to get it out. And so I think this book was just revolutionary for me. And I've sent it to every my patients as well.
How about yourself, Johnny?
Well, you know, I was just thinking about, you know, as I mentioned earlier, we had both had training in psychotherapy. So we've both been patients of psychotherapy. So we both really felt this way about the connection and the kind of bimodal communication between heart and mind and brain and body. And what's striking to me is how much the research has supported his intuition. They're writing now about, we all know, maybe people who are listening might not know, there's this major thing in the body called the vagus nerve, and its job is to do communication from the back of the brain all the way through, and it has outposts in the heart, in the immune system, in the gut, so there's really no more debate about body and mind and separation. The vagus nerve, that's why all that gut feeling and stuff like that, where so much 80% of your serotonin is made in the gut, and all of that information flows back and forth, and the science is supporting that. And there's a new book that just came out by a professor of medicine at Harvard who also has a divinity degree from Princeton, and it's called Cured. And they looked into some of these cases, remarkable cases of remission that are not medically explained, but are documented and stuff. And it seems that the thing that all of them have in common is that these patients somehow figured a way to tap into their parasympathetic nervous system and calm themselves down. A lot of them got, you know, stage 4 diagnoses. They quit their job, they moved to Costa Rica, and miraculously, you know, without thinking that was going to happen, you know, they did what Steve always talked about, which is to tap into that natural healing that the parasympathetic system does, the rest and digest system, and to be able to, you know, get off that treadmill a little bit. And that's all about emotion. That's all about stress and anxiety, and about, you know, finding stillness and finding calm and taking off.
I think you probably see a lot of this at the naturopath, but my last YouTube live was on this very thing, the parasympathetic nervous system and using the vagal, increasing vagal maneuvers and so forth. But we are so sympathetically overdriven. Look what's happening in the world right now. Besides our health issues, just look at the world, how divided we are in this country. And I mean, everybody's tense. I've never seen a tense world before. And, you know, so no wonder disease is rampant right now. It's terrible. So we need to really calm and do these, you know, that was one of the things that interested me about earthing and being grounded, is that I should help get back to your normal circadian rhythm and increase the parasympathetic tone. Very fascinating. Even taught me that.
Yeah, I want to. I guess I'm feeling called to like share these stories tonight.
That's great. We appreciate it.
My dad was a storyteller, you know. So when I used to shadow him when I was a teenager, and I think in my early 20s, I did a lot of shadowing of him, which I'm so grateful for at this point now. What I loved about the way my dad handled his patients was that he listened. right? He let them tell their story, and a lot of emotions would come up. Sometimes the patients felt rushed, but he'd always give them the time and the space to allow them to tell their story. And that in itself was the medicine, listening to the story, right? Because, the typical doctor's visit is what, 6 minutes, right? When you go see a conventional doctor. And so what do? You just go in, you got hypertension, you come back with a ACE inhibitor, whatever it is. But my dad was different. He had a little bit of a longer visit, and he allowed that space for transformation and for storytelling of the patient, which they needed. And that's primarily why I became a naturopathic doctor, because I was so interested in counseling. And really, he was doing counseling the whole time. And it's the psychoenergetic training that he did. And that blew me away with his patients, because he sometimes wouldn't even have to recommend something. He would listen to them, and they'd all of a sudden give him a hug at the end. And that was the medicine that they needed at the time. And I think my dad just had that uncanny ability to be present and to listen with compassion and open ears, and patients really, they came to see him for that.
And I think now with large medical groups and HMOs, and the medical world is so corporate. I'm still in my own individual solo practice. I'm a dinosaur, I guess. But, patients really appreciate this. And the number one complaint that, if you look at surveys with patients, they feel they're not being heard by their doctor. They don't feel heard. My mother, who's 96, says, yeah, they got 1 foot out the door, 1 foot in the door. And it's a complaint. Is it for people, they don't feel heard?
Yeah.
Yeah. And, unfortunately, it's the system. It's hard to blame doctors because they're part of the system. I know on the West Side, there aren't too many physicians who are independent. Most of them have become part of a group, and the group's been bought out by a hospital, and hospitals come in and, run the show, and, they prescribe to them how many people they need to see. And, so they're caught in the system.
Yeah.
So let's talk a little bit about earthing. And I know that that's something that Dr. Sinatra pioneered. And I know you worked with him on that earthing study, Howard. What is earthing, and what role can this play in heart health?
I think this is from a Marco. It's basically using the negative electrons from the Earth's surface. And, first of all, if you look at free radicals, they're positive. So how do you squelch them? Well, free radicals, it's the Earth's surface. And I did this, I'm not doing it as regularly now as I used to. When I would do earthing every single day, grounding in my front yard and so forth, I would literally feel tingling, from the ground within. I really felt that sense. But Stephen and I did it. We wanted to see the effects of blood pressure. We know it helps to decrease viscosity. We know it's anti-inflammatory and anti-aging. But the hint that also had an effect on blood pressure. We did a small study. Unfortunately, it was a grassroots study, so we didn't have a lot of patients. It was just me and a nurse that did this. But we did find a very positive correlation. You had to make sure the patients were grounded for at least 10 hours, which is hard to do.
How did you ground? How did you do?
We had grounding mats. We had grounding mats. We had the grounded sheets. We encouraged, they had to report it, and they came in once a month. I set this up with Stephen and Gaëtan Chevalier, I think, and we had a whole protocol set. And it wasn't easy to do, believe me, because it depended on people. It was difficult, but patients loved it, and they felt more calm. And here's the best thing, they felt they got more rested sleep. And in some of these patients, we weren't testing for this, the C-reactive protein, which is a marker for inflammation, came down.
Wow.
In several of these patients, so which is a marker of inflammation. So it's fascinating. I wanted to do. We talked about doing a bigger study and more studies, and we talked to Clint Ober. We never got around to it. I think that the reports on earthing and being grounded are significant. They're phenomenal. But for the medical world to appreciate this, we need to have more studies.
Yeah. No, agreed. And my dad was really big into understanding when this started to occur, when we weren't grounding anymore. And it was really when we started to wear these shoes that were rubber soled, which connected you from the earth. So if you ever met my dad at any point, he probably came walking through the door in these radical cowboy boots. I mean, he had ostrich cowboy boots and all these snakeskin ones, crazy ones. But those cowboy boots were grounded, right? They had a leather sole, and he, I think maybe unconsciously was moving towards the realm of grounding, even though he didn't really know it. But when he stumbled upon this, I believe it was like 2007, 2008, as I remember we were first kind of like talking about this idea of concept of grounding and earthing. You know, it really blew his mind. And I believe too, that it was great because I saw him bring the science of it into effect, meaning like, you know, like you were saying, Howard, this free flow of electrons into the body helps with, you know, free radical stress, etc. But I saw him finally like connect to the earth. And that was like one thing that made me really happy because my dad was always such this busy guy, right? He's like, go, 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 go. You know, always there for someone, traveling a lot, working a lot. And it was so good to see him ground out, as we called it, and connect to the earth. And not only get the physical benefit of this free flow of electrons into your body, but also this connection with Mother Earth that that I saw him evolve with over time. And it was great. It was great to see that. And he's such a strong believer in grounding. I can't tell you. I mean, he like every time we do something or go somewhere, he'd say, son, ground out. You know, so we'd fly in an airplane, go ground out. Like every time, just go ground out. So it's kind of imprinted in my mind, and now I do it with my kids too. I'll be like, kids, take off your shoes, go ground out.
You're right.
Yeah.
That's great. So maybe we, Johnny, do you want to add anything about the grounding?
No, there were times when we were doing the cholesterol book tour and we were doing appearances and stuff, and he was really into it. And I had the crisis of conscience that I felt it was outside the Overton window for our audience. And we were already taking on the medical establishment with such outrageous claims, you know, saturated fat doesn't cause heart disease and cholesterol is being measured wrong. And it's not you know, it was already a little bit outside. And when he started talking about grounding, I was just worried. You know, the Overton window, it's like, dude, it's a little too much. Could you, you know, maybe just don't talk about it on the Dr. Oz show, because I don't think that they're going to quite get it. And so I was always torn. I thought he was onto something, but I was fearful that because it was such a radical new concept,
Right.
and so easy to characterize, you know how conventional medicine would, I mean, you know what they, so I wanted to, not to silence him, but I wanted him to keep it private because I was afraid it would dilute or make it easier for people to dismiss our message about heart disease and the stuff we've been talking about the last hour.
The thing I remember about Steve is that he was so passionate and energetic. I mean, he could have sold me on anything, you know. So I just, when we had this luncheon and talked about grounding and, you know, would I be interested? I jumped at the chance because I felt somewhat protected by him, you know, because like I wasn't paving the way. He already done it or was doing it. And I was just kind of riding on his dovetail, you know. Mm-hmm. I was honored to be able to participate. It was great.
So maybe we could wrap up by saying something about what we should all focus on to help carry on Dr. Sinatra's legacy in the world.
Gosh.
Howard?
I think we've all said it, but, you know, I think because I'm in an active practice, I am living it every day, and I give him a lot of credit for how I practice, really. Because I mean, I don't think I'm a maverick. I learned from him and I gleaned from him, and so it just seems natural to me because I'm a thinker too, you know, and I don't just pass out pills. So his memory remains indelibly within me, and as long as I practice, as long as I live, I'll always remember the role that he you know, he played and how he helped me. So I'm very grateful having known him.
Yeah, I want to say that my dad was a phenomenal cardiologist. No questions about it. He was also an amazing heart doctor, right? And there's a difference there, and that is
good one.
He had such a high level of compassion and unconditional love for him, you know, for himself, his patients. I mean, you know, he had dogs, guys. He had like 2 or 3 dogs sometimes in the office come in with him. What doctor does that, right? What doctor does that? But it was you know, that in a way protected him actually energetically from some things that would go down with patients. But also, you know, it's, gosh, he just had such an open heart, and he shared that love with everyone, and that's what attracted people to him. And just his level of compassion is just, it's infinite. And that's the message I want to go out to people, is that we live in a very difficult time now. There's a lot of stress, and you know, it's very easy to be judgmental of others, but maybe open your heart more, and allow love to come into your heart, so that we can live more in peace in this world and not so much anger.
Beautifully stated.
That's great. How about you, Johnny?
I'm reminded of a parable I heard something I heard once to describe the difference between Eastern and Western medicine, and I think it describes the way Steve practiced. And it said that in Western medicine, we look at the symptom that the patient has in front of us. In Eastern medicine, they ask, who is this person in front of me?
Mm.
Steve didn't practice by lab tests. He practiced by treating patients, not numbers, not metrics. And I think that's probably the biggest message that the biggest tribute I can give him. He saw the person, the whole person, their story, everything about them. And the lab tests and the symptoms were just part of that. They weren't what he treated.
Thank you.
Awesome.
Well said.
Yeah, I don't think I have much to add other than to say that some of the most important messages I've heard from you guys is the importance of questioning orthodoxy and thinking outside the box. And even though medicine is a science, there's also an art to it. And listening to your patient, which is, you know, just so sorely needed, and to have compassion for your patients, and you know, do everything with a passion for what you do.
I want to thank you, Ben, for bringing this all together.
Thank
This
you,
was
Ben.
Ben's idea, and I jumped at the chance.
Thank you, Ben. And
Yeah.
thank you,
Pleasure
Howard.
meeting
And thank
you,
you,